Hey guys, it's Dr. Kelsey, and this is Jet here, a Labrador Retriever. We're talking about labs, and I want to bring up a topic about the condition of hip dysplasia. Hip dysplasia. A lot of people, most people have heard of it, but maybe don't know a lot about it. So this video is really going to describe or kind of outline a little bit about hip dysplasia. So first and foremost, there's a couple of reasons behind hip dysplasia. The number one reason is genetics. Okay, genetics. You know, the past history, you know, his parents, his grandparents, did they have hip dysplasia? That's really going to be your main component. Now, another component of it's environmental, meaning, you know, do you over-exercise him as a puppy, which you should not do, like running or taking him on, you know, 5-mile jogs 3 or 4 times a week as a 4-month-old puppy. That should not happen. And then second and thirdly is nutrition. So nutrition can be, if you don't want to supplement these dogs. We have great puppy food out there now that are large breed puppy foods. You don't have to supplement or add anything to your food. If you feed a good food, they're going to grow naturally at a good slow pace, and that's really what you want. So hip dysplasia again can show up. Typically does show up at a younger age. A lot of people don't know that. 6 months, 8 months, a year, you can start seeing dogs with hip dysplasia. Now, what are you looking for? Well, it could be a slowness to get up in the morning, okay? So their back end's a little bit slower. They're a little bit stiffer in the back end. It could be that they don't want to jump up on the couch or jump into your car. They could get more tired, like more lethargic, you know, that they throw the ball like 3 or 4 times and they're done. And you know, that's a puppy especially, they should be wanting to go, go, go. So those are some things to look out for. Now we on our end, a lot of times when we spay and neuter them, we will check their hips. There's a couple of manipulations of the hips that we can do to feel if the hips are loose, and if they are, we take x-rays. And that's the x-ray really is one of your best diagnostic tools for hip dysplasia to diagnose them. Now I just pulled a hip model. This is a hip model off the countertop here, just to show you. Now this is an arthritic hip, and that can look like that later on in hip dysplasia, not initially. But this is a normal hip, and what happens with hip dysplasia a lot of times is the ball and socket, that the ball part of it can be more flattened and not so round, okay? So it's not as round as it ought to be. And then a lot of times this, what's called the acetabulum, the part of the hip where the ball sits into, can be very shallow. So instead of being a deeper excavation, if you will, of the pelvis, it's shallower. So you can get some movement, some laxity in that hip. Now I'll say this too, that a lot of dogs that have it usually have it on the milder, moderate side. We don't see a bunch of severe cases of hip dysplasia, which is really good news for the owner and the good news for the dog, of course. But we do see some that are milder or moderate. And again, it kind of depends on the x-ray, it depends on the dog as well, like how they're doing. A lot of times if I diagnose it young as a puppy, I'll have an owner switch over from puppy food to adult food to slow down their growth rate. There are some procedures, if you catch it really early on, that can be done by some surgeons, by the specialty group surgeons, that sometimes can help this condition of the hip dysplasia. But if you fast forward, you know, let's say they're a year and a half, 2 years old, a lot of times we'll put them on maybe a joint food, and you're treating the symptoms. You know, there's not a shot, there's not a medicine per se to cure hip dysplasia, but we do treat the symptoms. So it could be joint food, it could be glucosamine, chondroitin products like Dasequin, and it could be anti-inflammatories. Again, some require, if they're really bad, it could be a surgery involved in the future. In fact, you know, we actually, we don't, but again, the surgeons do this, is actually a total hip replacement. And those are done, you know, not infrequently as much anymore. They're done a little bit more often by folks that want to go that route, but an actual total hip replacement. So, you know, those are some things about hip dysplasia. Again, luckily we don't see it very, very often, but it can happen and it does occur. And unfortunately it does affect the Labradors a lot. And those are the aspects about hip dysplasia. So I hope that helps explain hip dysplasia, that you've heard about it, and now you know a little bit more about hip dysplasia. Hey guys, it's Dr. Kelsey. Thanks for watching that video. If you like what you see, we'd love for you to subscribe and follow us. We're always trying to put out great content on a weekly basis, so continue to subscribe and watch us.